Historically, at least in the European Union, patients over the age of 65 were considered non-transplant eligible, and patients below the age of 65 were considered transplant eligible. But of course, our understanding now of patients who can undergo stem cell transplant safely has evolved significantly over the last 25 years. And now we're more interested in issues such as frailty index, the presence of comorbidities, rather than simple age. And for many years, Mayo Clinic has done autologous stem cell transplant based on performance status, cardiac, pulmonary, and renal function rather than age. Now, there's no question that the older a patient gets, less likely they'll be sufficiently fit for transplant. So there's a good deal of patient selection that occurs as you get older. And we've regularly transplanted patients between the ages of 65 and 70 and have previously demonstrated that these patients do just as well as patients under the age of 65, although the percentage of patients selected goes down. In the poster we presented at ASH, we actually looked at a much older group of patients over the age of 75, and we've actually transplanted 50 patients above the age of 75 with multiple myeloma. Now, recognize that, once again, the fraction of patients over the age of 75 that we elect to transplant is actually relatively modest. These are patients who are exceptionally robust, have a performance status of 0, have no cardiac pulmonary comorbidities. But having said that, we've transplanted 50 patients over the age of 75. Half of those patients were actually transplanted with melphalan 200. Half were transplanted with melphalan 140 milligrams per meter squared. And what we found is that, first of all, of the 50 patients, there was one transplant-related mortality. That would be patients who succumb for any reason before day 100. So the treatment-related mortality was 2%. But when we looked at the progression-free survival of the patients that were over the age of 75, it matched exactly those patients who were under the age of 65. What I'm saying, of course, is that patients selected for stem cell transplant at Mayo Clinic over the age of 75 do just as well as patients selected for transplant under the age of 65 with a very low therapy-related mortality. And so the key message is that stem cell transplant determination requires assessment of the individual patient and cannot simply be done based on age alone. And I think that summarizes that pretty concisely.